of the Shadow Cabinet with us today, and I'd like to welcome Justin to For the Many Mondays. And I'd like to, if you don't mind, Justin, I'm just going to mention a couple of things which I found out about you. You went to the wonderful city of Sheffield, and you were at the university there, and then you became a solicitor, all right, and you were also working on employment law, which is not a bad thing to work on. And then you were also a leader of the opposition for CWAC, and you then, and oh, the other thing was 2005, I think you stood for election in Tatton and came second to a previous Chancellor of the Exchequer. That must have been fun for you. And then 2015, 2017, 2019, 3 elections, you won them all in Ellesmere Port. And we're very, very, very pleased. Oh, I looked at your official title as well, and it's a bit of a mouthful, isn't it? The Shadow Minister for Secondary Care, Workforce and Patient Health, which is a right mouthful. But anyway, I'm absolutely delighted to introduce you, Justin. I'm so pleased that you're here and going to talk to us. I presume it's going to be about health. I presume it's also going to be about the bill, which is going through Parliament now. So I'm going to hand straight over to you, Justin. It's all yours, and welcome.
Right, thank you very much, Dave. Yeah, so I was going to start with my title, but as you already highlighted how snappy it is, I will leave it there. I'm not actually in the Shadow Cabinet. I am a front bencher, and I shadow the number 2 in the Department for Health and Social Care. And as the job title suggests, I basically do most of the front-facing NHS issues that you will all come across, with the exception of GPs, really. So A&E, everything basically the Countess does, ambulance services, and workforce is specifically in the title at my request, because I think that is such a huge part of the job. Without the workforce, the NHS doesn't exist, and I think we'll probably touch on that several times during the talk. So what I thought I'd do is I'd put the talk into 2 parts, really. I've been a Shadow Health Minister for actually 6 years now, with a brief break for reasons we won't go into. But I was reappointed in January 2020, when John Ashworth lost basically all of his Shadow Health Ministers in the 2019 general election. So I said I'd come back and help him out, not knowing at the time that we were about to enter into a pandemic, and therefore it was going to be the busiest brief of the lot. So what I'll do is talk the first half about what's happened during the pandemic, and you know what lessons we can learn, and then the second half I'll talk about what we're doing at the moment, which is the Health and Social Care Bill. But it has been pretty much full on from the day I got into the role, and it continues to be extremely busy. So it was about the time I took on the role that we'd heard about this virus from China that was starting to cause a bit of concern, and we know Matt Hancock came and gave a statement to the House. At that point, it was a concern, but nothing to signify it was going to be quite so dominant in our lives the next 18 months. Obviously, as time went by, we saw the images from places like Italy, where there were seriously overcrowded hospitals, people were on ventilators. It became quite apparent that this was actually a very transmissible virus, and also a very dangerous virus, and that the government really needed to step up and take more effective action. Now, you will recall at the time that the people who were brought back from Wuhan were all quarantined in Arrow Park for 2 weeks, and there was a lot of unrest about that, because no one really knew what we were dealing with. But actually, you've got to contrast that response with what happened after that, which was basically that there were no no attempts to screen people at arrival, which is how we ended up with the virus really getting into the country. I mean, I don't think we would have been able to stop it, but it's very clear that the complete lack of any border controls has caused actually several problems throughout the pandemic. And this was exemplified by a Prime Minister who was going around shaking hands with people with COVID, was not making any attempt to social distance, and was basically saying if people wash their hands, that would be sufficient. Now, it proved very quickly that that was going to be insufficient, and as we know, as history records, he was one of the people who contracted the virus himself, as did Dominic Cummings. And the less said about his reaction to the virus, the better. But this complacency was compounded by a lack of preparation, and there was really a decade of underinvestment in public health that has compounded the effects of COVID. And there was an exercise in 2016 called Exercise Cygnus, which basically ran through the government response to a pandemic, and that revealed a number of significant shortcomings. Now, we haven't seen the full government response to that. That's still going through various arguments, but what is very clear that there were a number of recommendations made there that weren't followed and probably made the situation much worse. One of those, as people remember from the start of the pandemic, was that we didn't have a sufficient stock of PPE. Now, PPE as a use by date, it was allowed to run out, and crucially for the purposes of the pandemic, there was no real thought given to how we were going to keep supplies ongoing. And then we get into the kind of cronyism which we'll talk on later as a response to that. But you will remember early on in the pandemic, doctors were wearing bin liners. Also, people were bringing stuff from home, from DIY shops. There was a complete failure to prepare adequately at the start of this, which made things much worse. Also, for reasons I've never really understood, we decided to stop contact tracing in early March. Now, contact tracing would have been a really good way to keep a lid on the virus in the early days, which I won't explain what contact tracing is now, because I think we all know what it is, but it's something that local council, public health bodies were proficient at. They were experienced at it, but a decision was taken, possibly because there was a feeling that the system wouldn't be able to go. But a decision was taken in early March not to carry on with doing that, which meant that the virus continued to spread out of control. Now, 2 months later, it came back again, but in between, we had our first lockdown, and you will recall at the time there was a sort of half edging towards a lockdown, and then a week later we finally got the Prime Minister's announcement on that. And the sage minutes, who are the scientific advices to the government, were already very clear 3 weeks before we actually locked down that the virus was transmitting throughout the country. And we know from what we saw in places like Italy that it was a serious matter. So question number one for the inquiry when we get to it is, why didn't the government act sooner? That's a pattern that we'll see repeated throughout the next 18 months. Anyway, we got to the first lockdown. The number of cases was rising rapidly, and then we got into this rather, I think, headline-grabbing drive to get 100,000 tests done a day. And you'll recall Matt Hancock made a big fanfare about that. Turns out that it wasn't 100,000 people getting tested each day, it was 100,000 tests. And it was actually a completely arbitrary figure, and it was there just to show that they were trying to make some progress, because without having the contact tracing systems in place, testing only takes you so far. And it was at this point that another fundamental decision was taken, which I think we will regret, which was to ignore and bypass the existing local government public health bodies and set up from scratch an entirely new private sector led contact tracing service. Obviously we know Serco have got billions of pounds from this, and throughout the pandemic it's been consistently shown that their effectiveness at doing contact tracing has been well below that of the public sector. And then we had the app, of course, which was supposed to be our panacea on a contact tracing, which never really worked. And we got then into the summer. Eventually the government decided actually wearing face coverings on public transport and in shops would be a good idea, but again they were very slow to decide that that was needed. And throughout this period of time there was very little financial support for those people who needed to self-isolate. And I can remember at the very start of this making the point that £92 a week for SSP was not going to be sufficient for people if they were having to do the right thing, even if they didn't have symptoms but needed to self-isolate. £92 a week was not going to be sufficient on SSP. The government eventually recognised that and in September introduced a £500 one-off self-isolation payment. But unfortunately, the way they did it was so restricted that only about 1 in 8 people actually qualified for the payment. It was run through councils. It's still run through councils, and of course they've got limited resources. So again, there were delays in actually processing those payments. But that failure to actually identify the need to financially support people to self-isolate from the outset was something I think that has contributed to the significant case numbers that we have seen. And then if we move on to September, after we'd had a bit of a relaxation of rules in the summer, we got really, I think, into a period of a couple of months where the government were frankly shambolic. We saw when schools and universities went back that there were surprise, an increase in the number of people contracting COVID. And indeed, it was also at that point that people were encouraged to return to work as well. But what was discovered was that the test and trace system hadn't anticipated this increase in demand, and we saw the ridiculous spectacle of people being directed hundreds of miles away from their home just to get a COVID test. And that was coupled by the ongoing failures in the test and trace system to meet anywhere near the numbers of people in 24, 48 hours that would be needed to enable effective contact tracing to be in place. And then we had this sort of rather unsatisfactory period of several months where the government tried everything they could to avoid a lockdown without actually confronting the truth that their own scientific advisors had suggested back in the middle of September that another lockdown was going to be the only way to deal with this. So who remembers the 10 p.m. curfew for pubs? Absolutely no evidence base for that to work, and indeed probably counterproductive when you looked at people being kicked out of pubs at 10 o'clock at night and massing in the streets and in the public transport systems. And then we had the tiers system, which really was a very divisive tool and ultimately unsuccessful, because we were able to see that actually, particularly with the Delta variant, that people were the Kent variant, people were moving around the country and the virus was transmitting very, very rapidly. And it really, I think, struck to the sort of heart of the dilemma the Conservative Party found themselves in, which was that they had this very clear public health advice about what they needed to do to restrict transmission of the virus, but they didn't want to have the economic effect of it. And what it led to was a kind of paralysis in government where decisions weren't being taken which were actually going to deal with the issue. And we saw all these very, very sort of strange moves to try and deal with it that didn't really have much effect. So eventually we got to the end of October and we did have that second lockdown for a month. But actually, whilst that did lead to a reduction in cases, that was very short-lived. But that didn't deter Boris from saying we're going to have our Christmas, and there was this special rule that we would have 5 days of normality at Christmas, which, don't forget, even a week before, he was insisting was still going to go ahead, even when it was absolutely clear from all the evidence that the number of cases was going up very rapidly. There was increasing pressure on the NHS, and that something more drastic needed to be done. Indeed, he was mocking Keir Starmer for suggesting that they might have to look at this again. But then eventually, 3 days before Christmas, he bowed to the inevitable and said we were going to have to shorten our freedom days over Christmas. By then, it was too late. People had already made their plans for Christmas and were already heading off. And it was shortly after that that we entered into another lockdown, because we had by then really seriously high numbers of cases. And of course, at that time of year, it's when the NHS is traditionally under the most pressure. So this third lockdown may well be the final lockdown, because there is nothing that we are hearing to suggest that they're going to go back into that mode again. We had a much more gradual release from it this time over several months, and indeed, you'll recall the final stage of it was delayed by a couple of weeks because of the case numbers. But what the government haven't done, as they've ended the restrictions, is actually look at some of the other things that could have been done and could still be done to reduce transmission. Obviously, face coverings is the obvious one that doesn't have an economic impact, but there are also other things about ventilation and improved contact tracing that could still have some impact. So we are now in a situation where we are back to normal in inverted commas, but we're still averaging over 30,000 cases a day. We still have over 5,000 people in hospital, which is nowhere near what it was at its height, but it's still a very high base to be starting from as we head towards the winter. As we know, people will be indoors more often, people will mix more often, and there is some evidence to suggest that the effectiveness of the vaccines begins to wear off as we move forward in time. So it's a period when I think we are going to be seeing the NHS again under huge pressure over the summer because of the level of COVID cases, because of the backlog in work that has built up, and also because of the impact of people having to self-isolate because of COVID. The NHS has faced winter level pressures, with the army having to come in to help the ambulance service, for example, but also people finding it very difficult to access their GP, facing incredible waits to get treated in A&E, and all the pressures that you would normally associate, including black alerts from hospitals for the middle of winter. So we are, I think, at a very dangerous time where the NHS will be under, again, unprecedented pressure during the winter. And it remains to be seen whether the vaccine does enough to keep us from tipping over. Let's hope that it does, but there's no doubt that the number of cases still being contracted is worryingly high as we move towards the winter. There hasn't been a spike that we saw at this time last year, but that may be because it's actually still at a very high level and hasn't really gone down over the summer. But we will see where we go. There's a booster vaccine campaign starting that's now beginning to roll out, and that's been a success. And indeed, that is a stark contrast to the private sector involvement in test and trace. But the NHS faces a critical few months, and we've got to keep our fingers crossed that we get through it. So in terms of where we go from now, the independent inquiry that we have been pushing for looks like it's going to be delayed until after the next election. I think the Prime Minister has finally agreed to meet some of the families of those who have lost loved ones during the pandemic, but it's still going to be delayed until I think probably after the next general election. it's really important that is as thorough as possible, because it's not got to just look at whether the government's preparations were right, whether the responses were right in the early days, but whether actually there is anything in the charges of cronyism. We know that a lot of contracts were handed out to people with very little experience in PPE in particular, but also whether the test and trace contracts were handed to the right people, and whether actually we were properly prepared. And what we would say is that actually 10 years of austerity left us extremely exposed, not just in the way our public services were set up, but actually the way our economy works. But we have had the highest death rate in Europe, and we've had the deepest recession in Europe, and that's something that the government have to answer for. So that's a quick canter through the last 18 months in COVID. And at some point during that period, the government decided that with the NHS facing these unprecedented pressures, and indeed facing a workforce which, in the words of even Jeremy Hunt, was burnt out, they decided it would be a good idea to undergo a reorganisation in the NHS. And that's led us to the Health and Social Care Bill, which, as Shadow Health Minister, I have the dubious pleasure of going through the Bill Committee stage in Parliament now. In terms of how legislation works, you have what's known as a second reading, which is the main set piece debate on the overall thrust of the bill in the chamber, which took place in July. And that's where Jonathan Ashworth and Sajid Javid sort of trade blows, and then any member can speak. Myself and my opposite number spoke at the end. But we're at what's known as the committee stage now, which is basically a line-by-line consideration of the bill. And that's where being a lawyer is quite helpful, because you can actually sort of understand, at least not all the time, what the clauses actually mean, and try and amend them and make them better, or try and get them removed altogether. Now, the Bill Committee has a comfortable Tory majority on it, so we don't expect to have much success on that. But what it does do is try and expose a little bit more than we can do in a set piece debate in the main chamber, some of the failings in the bill, and some of the areas where we hope the House of Lords will take an interest, and where they haven't got a Conservative majority, will be able to try and make something of the bill, and to at least make it slightly more acceptable than it currently is. But we start from the position that having a reorganisation at this time is completely wrong, and what it proposes to do will not address the challenges that the NHS faces. So it's the wrong bill at the wrong time, and I still think the government will come to regret trying to rush all this through, because it's all got to be up and running by next April, and I think it's completely unrealistic to expect the NHS to be reorganising in that space of time. But what it does do, and this is where the sort of detail comes in, is reorganise our current configurations of about 200 CCGs, the clinical commissioning groups, which, by the way, have reduced dramatically over the last few years, to 42 what are known as integrated care systems. Now, these are bodies set up over the whole of England, and they are wildly different sizes. They've been based on footprints that the NHS have more or less decided themselves, although they're trying to bring in local government for some support. But if you look at ours, for example, it's the whole of Cheshire and the whole of Merseyside, which is something like 10 local authorities, 2.9 million people, and a budget of well over £10 billion. So this is something that is going to be absolutely huge. And actually, I don't think a lot of people were really aware that this is coming along. So the integrated care system itself will be run by what is known as the Integrated Care Board, which is effectively a director's body for the whole system. The chair of that it's effectively chosen by the Secretary of State, although they're appointed locally. The Secretary of State has the final say on who they are, which doesn't give us much confidence that this is going to be a particularly inclusive recruitment process. We've actually said we think that these chairs should be elected by the local population, given the amount of money that they're going to be handling, given the importance of the NHS and social care, and given the relative size and budgets of what they're doing compared to, say, police and crime commissioners. We think there's a massive democratic deficit here. And then once you've got your integrated care board, you have what's known as an integrated care partnership, which sits sort of beside that. And that's where local authorities, other partners come in, and they kind of advise and set the strategic direction for the integrated care board, but they don't have any formal powers to actually make the integrated care board do anything. And that's a big failing in the bill. We think that the integrated care board can actually go on its own sweet way, and the local partners such as the council can be basically ignored. We also think that because the way the bill's written, it's not very clear who's going to be able to sit on the integrated care board. And we would like there to be a very clear compulsory element for someone who represents mental health, someone who represents social care, someone who represents public health, someone who represents trade unions, because we think the workforce have a really important role in this as well, and also someone who's actually going to be a voice for the patients. And the bill doesn't say any of these people have a formal role in the integrated care board, and it seems actually patient voice is completely forgotten in this. So we're going to have this massive body which really isn't going to be very accountable to anyone. Despite us having this bill so far, it's not at all clear how decisions will be made and communicated. It's not very clear how transparent it will be. These areas are going to be much more large than our current CCG, and obviously our CCG has got a lot bigger in the last few years from where it was. It was a West Cheshire CCG, and that's the whole of Cheshire. And obviously, if it goes to Cheshire and Merseyside again, it will be even bigger. Now, there is talk in the bill about the ICB delegating down to place lots of decisions, but again, there is just no detail about how that will happen, how it can be challenged, and how you will actually get democratic buy-in for it. And I think we're also a little bit concerned about if you take the analogy with levelling up, how some of the funding for these ICSs could be manipulated in a way that isn't going to be favourable for areas that we would like to see properly supported. There's no requirement for these bodies to meet in public, although NHS England said it's their preference. And one concern is that there is a statutory duty on the ICS to create a financial balance across the year, which obviously is something that you would expect anybody to do. But when you think about how most trusts or quite a few trusts end up each year in deficit, there is a worry that this is going to be used to try and impose cuts through the back door, and it's not at all clear how an ICS will actually be required to balance the books at the end of the year. So it has a repeal of some legislation on the Care Act, which requires patients to be discharged before assessed before they're discharged, which is a worry. There's been no assessment. That's been actually running in the NHS for some time. There's been no assessment of how that works. Good thing in it is that it repeals what's known as Section 75 of the Health and Care Act of 2012, which we would all know as the Lansley Act, and that was the provision, Section 75, that required all health services to be put out for tendering. That's no longer a requirement, but it doesn't actually replace it with any system at all. So it does leave open the possibility of cronyism. Now, we have tried to put forward amendments which would ensure that the NHS was the default provider in all circumstances. But if there was a situation where the NHS couldn't provide a service, that actually it was done in a way where there was full transparency about any contracts. And obviously, there are plenty of examples where this hasn't happened. We also have a requirement for each ICS area to publish a plan to show how they would reduce their reliance on the private sector year on year. But again, that hasn't been accepted by the government. One area where we have had a little bit of success is our amendment to remove the need for a private company to sit on the ICB. At the moment, the bill doesn't say anything really about who can be on an ICB, so it doesn't rule out private companies doing it. And obviously, we don't want the likes of Virgin Care making decisions about how NHS services are run in our area or any area, and it's a massive conflict of interest. And I think the government, after a pretty big campaign from ourselves and other campaign groups, accepted actually that is quite a flaw in the bill. So they have said that they will come back with some wording that will ensure that is not possible. We will wait to see what they come up with. If they don't come up with something that we're satisfied with, we will resubmit our amendment. But that's the one success that we've had so far in this, and well, the jury's out about whether we will actually succeed in getting that written in the face of the bill in a way that we're satisfied with. But it was quite a big move, because it's the first time we've got them to admit there's a problem with this. There's also in the bill a requirement for the Secretary of State to produce a statement on workforce planning once every 5 years. And I think just about everyone who is involved in health thinks that is frankly pathetic. It doesn't cover social care for a start. It's not a serious commitment to the workforce, and actually producing a piece of paper every 5 years is not a substitute for a proper plan. Now, as you will know, we've got around about 100,000 vacancies in the NHS at the moment, of 122,000 in social care. We know that during the pandemic they've gone above and beyond and are at sort of point of absolute exhaustion. We know that demographics of the workforce are such that there are going to be a lot of people retiring over the next few years, and that a lot of people are thinking of leaving anyway, simply because of the pressures. So the need for a proper strategy to actually address the workforce crisis is something that I think everyone in the health world agrees on, except the government. And we've pushed for amendments on that and haven't been successful so far. And that's, I think, symptomatic of really our analysis of the bill. It doesn't really address any of the issues that need addressing. It doesn't address the force gap, the huge challenges of health inequalities COVID has identified. Can you hear me all right?
Justin, you're breaking up at the moment. Is there anything you can do at your end?
Can you hear me? Can you hear me now?
Yes, can. Can you hear me?
Right. I can hear you fine, yeah. So I don't know how much you got of that, but basically we're just saying that there are many things that the bill just doesn't talk about at all. So health inequalities, workforce crisis, the fact that we've got a record waiting list of 5.5 million now, which we should not forget was already at record levels before COVID. We shouldn't ignore the fact that more and more people are being tempted to go into the private sector to get their healthcare because of the wait that they're facing. The fact that actually the bill doesn't prevent more resources being diverted to the private sector it doesn't do anything to address the fact that life expectancy is stalling. It doesn't do anything to address the crisis in social care, nor the fact that any targets, as well as most other government targets, have been missed for 5 years in a row. So in terms of why it doesn't work, why it doesn't do what it's supposed to, is it's very clear that whatever integration means, it isn't going to address the challenges in the NHS. So I think that's probably more than enough time, Dave, so I'll stop there.
That is cool. Thank you very, very much indeed, Justin. It's really great. It's a very, very good comprehensive view of what has actually happened over the last 18 months and what might be happening in the next 18 months. What I'd like to do now, if it's all right with yourself, Justin, is I'd like to open it up and ask people if they've got any questions to ask you. And the way we do this is very simple, is that if you put your hand up, and I don't mean physically put your hand up, I mean using the information you've got on your Zoom to actually put a hand up, which someone has already done that, which is Lynn Loyley. And so Lynn is going to ask you the first question, Justin. Lynn, all over to you. Don't forget to unmute.
Right, thank you very much for that. I'm especially interested in the committee stage of the bill and all the work that you've been doing. Obviously, you've had some success there with the private sector involvement, hopefully. Is there really very little chance of any other amendments getting through in the Commons, and the only hope being the House of Lords to get through some future amendments?
Justin. I think we might have lost Justin. Are you still there, Justin? If you can unmute. It's a bit unfortunate at the moment. Hello, Justin. He's disappeared. His video has disappeared. And also there is, he hasn't got his audio on. Oh dear.
Looks like he's gone off and he's going to come back again, perhaps.
Well, we hope so. We very much hope so, because I hope that Lynn's question didn't put him off. That was a joke, by the way. Which is always unfortunate on these things. You can't run away if you're face to face, but unfortunately you can run away if it's on Zoom.
Oh, he's back.
Great.
There we are. Yeah.
Justin, are you with us?
Yeah, sorry, I lost my connection there, so I didn't catch your question at all. Then.
Right. Okay.
It's not that I didn't want to answer it. I think there are obviously some problem there.
Lynn, would you like to repeat yourself?
Right. Take two, Justin. I was saying that I'm interested in the committee stage that you've gone through, the sort of line by line stuff, and you seem quite optimistic about one of your amendments with the private sector involvement. But I wondered, are any other amendments more or less a lost cause in the House of Commons, and we'll have to rely on the House of Lords to try and improve the bill?
Yeah, I think that's a fair comment. I mean, the general sort of rule of thumb is that the government don't make concessions at the bill committee stage in any bill. So the fact that they have done on this is pretty unusual. So, I mean, we went into it thinking that there are lots of things that they ought to agree to, but they're not going to. And actually, it's only when things go through the House of Lords that there will be a chance to change the bill. So I don't think there'll be any more changes. I mean, it's always been our strategy to expect things to come back from the other place in a better state than we left them. But as it stands at the moment, the fact that we've got one concession actually is pretty impressive, I have to say. Don't want to sound like I'm blowing on my own trumpet, but we weren't expecting that. But until we've actually seeing what they're going to come back with, and hope, hopefully deal with the point that we're making. We will reserve judgment on that.
That's cool. Thanks, Justin. The next person, now it's John or Jackie. I will put a bet on that John wants to ask a question. John.
Yeah, you've succeeded there. You got your prediction correct. I've been to a number of meetings on this subject, particularly around integrated care systems. And what you hear from some speakers is that integrated care systems are bad, full stop. Now, when I've sort of tried to probe why this is, because integration of services sounds good, and we've been in favour of it in other places, but the only thing that people can, when you probe into it, the only answer I've got is that it kind of fattens up the system, if you like, for privatisation. Is it possible for an entire integrated care system to be sold to I don't know, an American healthcare company or something like that, because that's what I hear people saying, and I say, well, if there was a Labour government in a fortnight and we inherited integrated care systems, we could make it work well. We wouldn't allow privatisation. So, what do you think, Justin?
Well, if you look at actually Greater Manchester, they've been doing integration for quite a long time, and that's obviously Labour led. So there isn't an ideological objection to integration. It can work, but I don't think this bill is really the answer to it at all. I think that the point about whole systems being sold off to American healthcare won't really work, because the trusts themselves will still be independent legal entities. It's about how these bodies will have enormous power to hand out the contracts to run things. That's where we've really got to make sure that things are done properly. That's where the risk I see in this is, and actually integration can't be done by Westminster in legislation. It's got to be done on the ground, and obviously there are ways that can be done much better than others. But I think this bill doesn't address integration in the way that people fear, nor in the way that we would want it to see happen anyway.
Thank you, Justin. Thanks for the question, John, as well. Paul, you have a question for Justin.
Mine's on the health, social care, really. What's Labour's position on this requirement for vaccination for care home workers, bearing in mind that the vaccination is not a sterilising immunity, so you can still catch the virus even though you've been immunised, and they can have visitors who've not been immunised, and they are so short of care workers that it's going to endanger their care more by the numbers that will be happen to be leaving, than if they just said, okay, well, if you test before you go to work, then that should be sufficient.
That's a really good question, because it's going to be a huge issue over the next 6 to 8 weeks, when the legal deadline comes in for care home staff to have been vaccinated. Now, it has been a subject of some debate in the party, but we in the end decided that we didn't agree that it should be compulsory. Obviously, we want care home staff to be vaccinated, and we would do everything we can to encourage it. And when you think about how poorly the care sector was treated during the pandemic, particularly at the start, this talk of a protective ring was just such a hollow phrase. We understand how important it is that people feel that they are safe in care homes, but we actually think that making it compulsory is counterproductive. The research that we've seen suggests that if you do bring in an element of compulsion into this, it actually pushes people who are unsure away. I've had several constituents who don't want the vaccine, who work in care settings, come to me about what they're going to do, and they've got various reasons. I'm not going to judge their legitimacy or not, but I believe they're genuine people, and the element of compulsion here is actually quite a disincentive for them. It really is making it harder for people to do. And the bottom line on this, which is really probably what sort of prompted us to say we can't support it, is that we've got 122,000 vacancies at the moment in the social care sector. We know that there isn't a plan to address those vacancies. We know that there will be, possibly between 5 and 10% of care home staff who don't get vaccinated, and they won't be replaced. And because of a whole range of factors, this isn't going to be evenly spread. There will be some areas where virtually everyone is vaccinated and there's no problem. There'll be others where it will make the difference between a care home being able to open and not, and actually it poses a real risk to the sector overall. So we think that this is going to cause some real problems in a few weeks, I'm afraid.
That's fine. Thank you very much, Justin. Has anybody else got any questions? Because I can't see any hands up at the moment. And if there are no hands up at the moment, I think I will try to ask a question. But it was, I just got very, very upset with the way the government actually ran the COVID adventure, if you'd like to call it that, because I believe it was an adventure for them. They started off with the idea that they wanted herd immunity. They didn't put the ring fence around social care. They did everything they possibly could to prove that their way forward was the best way. And I just wonder now, if they still believe in herd immunity, whether they are as callous as they seem to be, and whether actually Johnson says, pile them up high.
Well, those comments, I don't think have been absolutely denied, have they? And they've been sourced by several people, but it's the sort of thing that I can imagine him saying. And when you look at the way the government have reacted, particularly during the first half of the pandemic, it kind of explains the indecision and the failure to actually take the necessary action that was needed to address the outbreaks by bringing in firmer and quicker lockdowns. But what it has shown is that overall, the government's approach of the last decade to run down public services has made things far, far worse than they needed to be. So you can put this into two parts really. The decisions that were made during the pandemic, and even the harshest critic might say during the early part of it, there was some uncertainty and perhaps some leeway about how quickly decisions were made and whether they were the right decisions. As time went on, that became harder and harder to defend. And then the other part of it is, were we as a country, as a society, as a government, as all the elements of public service actually prepared for when this hit? And the answer to that is absolutely clearly not.
Yeah, that's cool. Thank you, Justin. We've had, that question has given someone else an opportunity to think of a question, so I'm going to go to Sheila. Sheila, your question. You will have to unmute, Sheila.
Okay.
That's fine? Brilliant.
Thank you. Hi, Justin. A couple of questions really about social care. The increase in national insurance was sold to the public on the sort of pretext that all this money would go into, well, I understood it, that the money would go into social care. whereas in actual fact, it's going to go to the NHS, and it says for the first couple of years. What can we do? Because you know, and I know, that the health service will never release that money into social care. So is there anything that the government can do that, if we're not in power, to make sure that that money, like, you know, will go to social care? So that's number one. And then number two, the government seem willing to put out visas for HGV drivers and for people to work with turkeys, but they're not prepared to have extra visas for social care staff. You know, turkeys are more important than people. So again, is there anything that the party can do to put pressure on them to release some additional visas? Thank you.
Okay, well, that's two really important questions. I think coming back to one central point, which is that the Prime Minister promised to fix social care, and whilst he may now say that he has, I think it's very apparent to all and sundry that what he's come up with is, well, another tax, basically, isn't it? It's the health and social care levy is, as you quite rightly point out, not going to be primarily on social care. It's going to be dealing with waiting lists, and actually I'm not convinced that it's going to make much of a dent into the 5.5 million people on the waiting list, because actually I think that's probably going to go up because of several things. First of all, demand that hasn't made its way into the system yet, because every stat you look at suggests the number of people you would normally expect to come forward during a year hasn't happened for 18 months because of COVID. Secondly, who are these people who are going to be doing all these extra operations? Because even if it's the private sector, it's quite often still the same consultants, the same anaesthetists, the same doctors and nurses doing those procedures. And then thirdly, it is a movable feast, and I worry that actually what we will see is we get to 3-4 years down the line, people are paying this levy, and actually you're still getting people who are waiting over a year, 2 years in some cases, in a lot of pain. And this is before you even get into the scandal of how long people have to wait to get a mental health treatment or even an assessment. And it will undermine the basis of the NHS, because people won't believe that it's fixable. People won't believe that they can get the standard of treatment that they need on the basis of the system that we've got. And in terms of the social care aspects of it, this levy, from what I've been told, is actually going to push some social care providers over the edge, because actually it's an extra, because don't forget, because this is national insurance, they've got to pay, companies have got to pay as well as the employees. So not only does it make it less attractive for employees as a job, but it actually adds extra costs into the employer as well. And this is at a time when obviously we've got a workforce that is shrinking, because we haven't got the same pool that we used to have when we were in Europe. And obviously we've got the issue we just talked about with vaccinations, where we're going to see less people in it as well. And I really worry that we're going to see people who are basically just not going to get any help at all, because the system will be so overstretched. So the idea of extra visas is one we've been on from on the start, really, because the way the government's immigration sort of threshold, it works on a salary basis to start with, and it's well above what most care workers would expect to earn, which of course is another point. And it does seem at the moment, and we've even heard this with the lorry drivers, which is probably the most explicit example of how you do need some sort of immigration system. The government's stance seems to be, we're not going to, despite having issued several thousand temporary visas, they have basically said, we're not going to turn the taps on for for immigration, even in this circumstance, because it's uncontrolled immigration. Well, it's nothing of the sort. It's the absolute opposite. It's controlled immigration because it's a specific workforce for a specific time. So if they're not even prepared to address what is a very apparent shortcoming that's affecting the entire country, I just don't think they're going to be prepared to do anything for social care, and I do think we're going to see some real problems in the sector in a very short period of time, I'm afraid.
Yeah. One final question. It's from Linda. Linda, your question.
Hi there. I'm just thinking about this shortage of care workers, and it seems to me that solutions are not really so much to do with vaccinations or visas, but about significantly improving the terms and conditions of people who work in social care, and making it a more attractive job. And that doesn't seem to be part of the discussion. There was something in the briefing about this health and social care bill about funding that's been made available to local authorities, and there was a quote of £500 million over 3 years to support the social care workforce. That doesn't seem like a big amount of money, but it seems that there are some promises of money for to improve things for the workforce. Or am I being naive in that?
I mean, this is obviously something that came up at the party conference. It's very clear that social care is a very rewarding job, but it's also a very pressured job, and you've got the indignity of 15-minute visits where people don't really get time to actually do the job properly. You've got the fact there isn't much opportunity to progress your career. You don't get proper breaks, you don't get any training. You're sometimes having to use your wages just to travel between jobs as well. So it's a really hard job. It's very poorly paid, and it isn't, I think, valued enough by our society as a whole. So 500 million is not going to touch the sides on this, I'm afraid. And I mean, I would love us to be able to say we'll pay a lot more, but this isn't going to happen overnight. But in the long run, there are lots of jobs like this where actually the only answer is to make sure that not only is the pay attractive, but actually the working conditions are much better, so people feel properly valued and supported. And there's all sorts of reasons, as I've just gone through, why people actually in the end decide they go and do something else, because it's an easier job, even though actually they do love caring and they find it really rewarding.
Thank you. I knew I would get a couple of other people who wanted to ask questions. Have you got time, Justin?
I've got time for one more, and then I've got to go.
Well, I will leave Ray McHale to talk to you on his own, as he's one of your constituents, and I'll go to Dorothy.
Be here at all. Is it
I'll go to Dorothy. Dorothy, your question.
Good evening, Justin. Yeah, I just wanted to mention about social care, because if you remember way back, they were saying that they were integrating social care and health. So it makes you wonder what really happened with that, because we all thought, oh, that might not be bad, because one another will talk. They'll talk to one another then, because communication sometimes doesn't work between health and social care. So now they're saying they're integrating health, but it's not going that way, and it's not the right way. Also, if you think over the years, social care has been going on the council tax bill as well. So there's something seriously going wrong with social care. There's something very suspicious, and when you think about health, that's all I wanted to say, because I think they pull the wool over people's eyes, haven't they?
Thank you, Dorothy. Justin.
Well, I'll just briefly say I would challenge anyone to point out to me in the bill where it says this is how integration will work and this is why it will be better than it currently is. So that's actually the minister's job. But if anyone can help me on that, I'd be delighted. And then you made a really interesting point about council tax, because for the last few years, the government have basically been sidestepping the fact that they've took 8 billion out of social care over the last decade by putting more and more on local councils and actually council taxpayers, because council tax is a regressive tax, and asking people to pay more and more through the precepts. And I have heard nothing in the last month, despite the social care levy, to suggest that actually that precept isn't going to keep going up year on year, and councils will have an extremely difficult time explaining to people why they've got to put more into social care, because the demographic pressures are still there and the costs will continue to rise. But people will hear what Boris Johnson has said and think that the whole thing's been solved. So we've got a bumpy road on that, but you'll get found out eventually. I'm confident of that.
Thank you, Justin.
All right.